The month of May is ALS Awareness Month, most commonly referred to as Lou Gehrig's disease, after the famous baseball star Lou Gehrig and his luckiest man on the face of the earth speech that really helped to bring about awareness to ALS when he bid farewell on July 4th, 1939. 1 or 2 out of every 100,000 people develop ALS every year, and most commonly it strikes people between the ages of 40 and 60 years of age. But at this point, there is no known cure. On this edition of Tampa Bay Tomorrow, I'm your host, Corey Dillon, and we are joined by Dr. Clifton Gooch, professor and chair of the Department of Neurology at USF, and he founded the ALS clinic in Tampa at the main campus at USF. We also have with us Alissa Gutierrez, the marketing director of the ALS Foundation, and retired Navy vet, a SEAL for 27 years, and senior enlisted medical advisor at U.S. Special Operations Command. We welcome Doc Welt to the program. Thank you all for being here today. We wanted to talk about this debilitating disease, where we are in the search for a cure, and why ALS is affecting so many of our service members. Dr. Gooch, can you explain to us, starting off here, what is ALS exactly?
ALS is a progressive disease that gradually damages the nervous system. It causes progressive paralysis, usually starting with the arms and legs, then difficulties with speech, swallowing, and ultimately breathing. As you mentioned, at the present time, there is no known cure, although promising research is moving forward at an accelerated pace. But that's the general summary of the disease. It's a group in the group we call neurodegenerative diseases that tend to progress inexorably.
Okay. And how is it determined that a patient has ALS? My understanding is that there is no one definitive test.
Yes, that's right. So ALS is a clinical diagnosis, meaning that we have to rule out all of the other things that can mimic ALS first, which involves a medical workup. After that's completed, then if all other suspects have been excluded, then you're left with the diagnosis of ALS.
Okay. I'd like to talk about how ALS usually starts to manifest itself and who is most likely to develop it. So, Dr. Gooch, can you give us sort of what the established risk factors are, some environmental factors that you believe may cause this disease?
Sure. There are two major categories of ALS. There's the hereditary variety, which runs in families, and patients generally know whether ALS is in their family. So that's a pretty clear group. There's also the group of what we call sporadic ALS. This is the variety of ALS that strikes like lightning. As our knowledge has advanced, we've looked harder and harder for clues as to who may be at risk for ALS. There aren't a huge number of risk factors for this sporadic form. It seems to be fairly random. However, in recent years, it has become very clear that those who have been in military service are at increased risk. Interestingly, also people who've been varsity athletes are also at increased risk of ALS. So there are some factors that, if you will, may predispose to the development of ALS, which remains still a pretty uncommon disease, striking about 1 in 50,000 people.
And when you talk about the fact that our military community is affected, it's not just a little bit. It's twice as often as the general population. Is that right, that they are affected with ALS?
Yes, the risk is substantially increased. This was the subject of an Institute of Medicine report not just a couple of years ago. And it's unquestionably true that the risk is substantially increased in veterans as opposed to the general population.
Okay, and as we search for an answer as to why that is, the Tampa Tribune recently featured Doc Welt, who is here with us today. He led the Walk to Defeat ALS. He literally was the first one over the gates there. And Doc, can you tell us your story when you first started to, I guess, notice that something was off and what led to your diagnosis?
I think my first notice of something different and out of the ordinary from my regular routine was in the summer of 2011, where I started feeling just generalized weakness, wake up in the morning feeling kind of like I'd been through a train wreck. But I didn't have any real physical debilitating problems at that time. It was just general weakness. Or if I'd go for a run, right, I wouldn't be physically tired, but my legs would give out a lot quicker than anything else. And I gaffed that off for a long time as a previous neurological condition with some spinal cord injuries or spinal injuries that I'd had in the past and some orthopedic issues.
Okay.
So I didn't think anything about it and continued to work at U.S. Central Command for about 5 years at a desk job. So again, I didn't notice it. I wasn't doing anything out of the ordinary. I left Central Command and went back out to do some counter-piracy work, protecting those who weren't able to protect themselves on American vessels. And I started noticing a generalized weakness when I'd wake up in the morning and on the ship, and I was having difficulty getting around on the ship, on different ships, up and down the ladders and things like that. My last trip, unfortunately, was scheduled to leave on August 15th of this last year. I got off that trip on September 12th, and I thought that I might have had blood clots because I have had some severe pain in my lower legs, very great difficulty walking between the aircraft at JFK coming back down to Tampa. So we started chasing that down, and I went and saw a neurosurgeon here locally, and he advised me that what he was seeing on my films was not indicative of the symptoms that I was explaining.
Right.
So we went and saw another neurologist who specializes in EMGs, and she made the determination that I have motor neuron disease. So it was very, very quick and very, very rapid onset for me in the reality that 5 months ago or 6 months ago I was walking, talking, and moving around normally and fully functional.
Right. You know, I know that anytime somebody is diagnosed with something, one of the questions they might ask is why, and obviously nobody wants the answer to that question, probably more than you. Do you think that your military service had anything to do with it? I mean, have you searched for that answer and come up with any reason why you think something in your past might have led to this diagnosis?
Well, as Dr. Gooch said, it strikes me as unique and very strange that that military personnel are twice as susceptible to contract, ALS,
right,
in its true form, as well as professional athletes. And that leads me to believe that there could be something within the high stress environment, constant physical exertion,
right,
and just the general attributes of being a professional athlete or professional soldier that causes the motor neurons to break down quicker. I also wouldn't count out the potential of being exposed to who knows what, down
right,
the line. I mean, I've been everywhere from Ground Zero 9/11 to, the Middle East to down in Central South America to Asia, all over the world. And, when you're exposed, Africa, you're exposed to many different environments, many different disease processes. There's no telling, what it is. And the thing that really, I think, bothers me is the amount of research money that is, failing to get to those like Dr. Gooch and Dr. Vu, my treating physician, so they can conduct the research to figure it out.
Well, why do you think that is? Why do you think enough money isn't going there? It's just not affected the right people yet, or enough people? Because I know there are certain causes, obviously, that get a lot more funding than others.
The big three, cancer, heart disease, and I'm drawing a blank here, but it seems to me that ALS is weakly advertised, although the ALS Association and those that are involved with it, and definitely the families and those that are working in the medicine side of ALS, they fully understand the ramifications of this very, very rapidly progressing disease, much more so than cancer, in my opinion. I mean, I've seen where I've gone in 5 months or 6 months in a very short period of time. And the diagnosis that was given to Lou Gehrig in 1939 is the same diagnosis I got. You've got it. We don't know how you got it. Welcome. And unfortunately, you've got 3 to 5 years to figure it out.
Yeah.
And if I could comment on that point, because there is this concept of what we call the valley of death in terms of research funding, and just briefly to talk about how we develop treatments for disease, because the bottom line is we want to be able to treat this disease.
Right.
So understanding the cause is part of it. We actually have a lot of clues as to the causes that propagate the disease once it's established, and so there is NIH and some government funding that goes towards understanding the causes. We certainly need more of that. We also have partners in the pharmaceutical industry who are willing to partner with us when we have a strategy that has proven itself in what we call pilot trials as being a promising potential treatment that will then pick up the ball to carry the cost of what can be up to $125 million to put a drug through all the paces necessary
Wow.
for FDA approval. Now, the Valley of Death is those early trials where we need to get a few patients together to test promising new treatments based upon laboratory evidence and increased understanding of the disease, because the NIH doesn't fund as many of those pilot trials as we would like. In fact, they fund very